Okay, so you've had conservative management of your disease, you've had anti-inflammatory medication, injections, physiotherapy, you've lost some weight, and yet your symptoms are progressing. In that scenario, what I'm looking for is clinical and radiological evidence that you have reached the end of the road. And by those symptoms, what I mean is the impact your arthritic knee is having on you in your day-to-day activities. So you may be struggling going for a walk, you may be struggling getting out of a chair, turning in bed at night, you may really struggle going up or down or stairs, kneeling, squatting, cleaning out the fire, daily activities like getting out of a chair, getting out of the bath. These kind of things become increasingly difficult, and you find yourself reaching for anti-inflammatories and painkillers on a daily basis, and your knee is sore and irritable and you're limping. In that scenario, with an x-ray where there's no cartilage left in the joint, knee replacement becomes not only viable but something we would recommend.